Session 4.2. Proposal Development. Session 4.2.1. Defining the research problem. Objectives. Knowledge. Describe the process of defining research problem. Describe the elements of a research problem statement. Skills. Prepare a research problem statement in clear and concise manner. Formulate SMART research objective. Attitude. Describe the importance of the research problem statement before designing research. The research process. Technical process. 1. Identification of research problem, stating the problem, analyzing the problem, stating the research question/hypothesis clearly. Research problem statement, question and its context. 2. Planning, setting the research objectives, literature review, designing the research, research design, sampling design and sample size, plan for data collection, plan for data processing, plan for data analysis, plan for dissemination of results. Research proposal. 3. Implementation of plan, data collection, data processing, analysis, interpretation, writing the research report, research manuscript. 4. Dissemination of research results. Ask AI. Alt. 1. Identifying/stating the research problem. 1.1 Select a problem area on a specific topic, X health problem. Downward arrow narrow down the problem area in researchable terms. 1.2 State the research problem in researchable/measurable terms. Downward arrow. Transform the identified problem, health problem, in a way that lends itself to investigation research problem. Downward arrow. Narrow down the health problem in researchable terms. Researchable problem statement equals focused on a study variable, a study unit, and time, if applicable. Note, research demands a clear statement of the research problem/Q. Specifies the following elements. 1. Study variable, characteristic. 2. Study unit. 3. Time element, if applicable. Problem area downward arrow. Need for interventions to improve compliance to HPN medication. TB has remained prevalent despite availability of effective and accessible treatment. Controversy regarding the use antibody-based test kit for COVID-19. PhilHealth members unable to avail of PhilHealth hospitalization benefits. Poor quality of data routinely collected by RUS. Research problem statement. Stated in researchable/measurable terms lend to investigation. Elements, study variable, study unit, time, if applicable. Research problem, requires scientific inquiry for its solution. If yes, is it researchable? Researchable. Variable plus study unit specified. 1. Is herbal medicine widely used? Research problem. X researchable, variable, herbal medicine use, study unit dash. Is herbal medicine widely used among Filipinos? Research problem. Researchable, variable, herbal medicine use, study unit fill. 2. No Bimong facility in province X. X research problem, problem area. 3. Poor quality of data routinely collected by RUS. X research problem, problem area. 4. PhilHealth members unable to avail of PhilHealth benefits during hospitalization. X research problem, problem area. Research problem is a statement about, concern/issue, gap in knowledge. Requires research for its solution based on knowledge generated. Stated in measurable terms. Elements, study variable, study unit, and time, if applicable. 1.1 Identifying the problem area on a topic of interest. Downward arrow transform. 1.2 Stating the research problem, measurable terms. Transforming health problem to research problem. Example 1. Topic, Health Information System. Problem, poor quality of data routinely collected by RUS. Poor data quality leads to low level of data utilization at all levels, from the RHU to the regional levels, hence wasting time and resources in data collection. Poor data quality is an inhibiting factor to evidence-based decision-making, Mendoza, O. 2019. Examples of research problems/questions. What proportion of RUS have poor quality of routinely collected data? What are the factors that influence quality of data in the RUS? Does attitude of personnel towards health data influence quality of routinely collected data? Example 2. Topic: PhilHealth benefits. Problem: PhilHealth members unable to avail of PhilHealth benefits for hospitalization. Hospitalized members shell out money before discharged. Burden on the PhilHealth member. Examples of research problems/questions. Are hospitals compliant with the policies and guidelines regarding hospitalization claims of PhilHealth members? What are the factors responsible for the inability of PhilHealth members to avail of hospitalization benefits? Types of research questions. Sanchez, F., Morelos, S., Baltazar 1989. A quantity to estimate. A characteristic to describe or compare. An association to establish. Quantity. Characteristic to describe. What proportion of COVID-19 laboratory-confirmed cases have clinical signs and symptoms? What is the geographic and temporal distribution of COVID-19? Is there an association between age and COVID-19 mortality? What proportion of intubated COVID-19 patients died? Is the risk of death higher among intubated COVID-19 patients? What proportion of Filipinos know about the mode of transmission of COVID-19? Exercise 2. Classify the type of research question. A. Quantity to estimate. B. Characteristic to describe. C. Association to establish. 1. What is the demographic and clinical profile of COVID-19 confirmed cases? 2. What is the time trend in utilization of AP services before, during, and after COVID-19 pandemic? 3. How does X, intervention, compare with Y, no intervention, in the management of pain among patients with chronic back pain after 2 weeks? 4. What is the prevalence of malnutrition among children? 5. What is the risk of fatal heart attack among obese compared to non-obese individuals? 2. Clarifying the research problem. 2.1 Analyzing the research problem. Downward arrow. For feasibility, significance, ethical soundness. Dissecting the problem. 2.1.1 Determine if problem is feasible. Practicality of undertaking research. Is there enough time and money to undertake research? Are there enough study participants and are the target participants willing to participate? Is the method of collecting data or measuring the study variables feasible to implement? Is there available facility/equipment for measuring the variables of interest? Are there ethical issues? Significant. So what if you have the answer to the research question? Downward arrow. Addresses a health problem/contribute to its solution. Lead to practical application in healthcare or service delivery. Improve delivery of healthcare services. Improve the practice of profession. Ethically sound. Ethical considerations. Are there risks to the study participants? Are measures in place to ensure protection of research participants? 2.1.2 Dissect and clarify the research problem. Identify related components of the problem. Rightward arrow. Subproblems. Help define the scope of the problem. Clarify the focus of the problem. Example 1. What is the cap on HIV among CSWs? Dissect and clarify components. Knowledge. Attitude. Practice. Cause. Towards HIV. Condom use. Transmission. Towards use of condom. Prevention. Treatment. Example 2. Is herbal medicine widely used among community residents in Region 2? Dissect and clarify components. Type/form. Herbal preparation. Type of illness. Characteristics of people using herbal medicine. Age group. Educational attainment. Etc. 2.2. Formulating research problem and the subproblems in clear, specific, and measurable terms, and research hypothesis, if applicable. Example 1. What is the cap on HIV among CSWs? Dissect and clarify components. Subproblems. Main problem. What is the knowledge, attitude, and practice of commercial sex workers, CSW, regarding HIV? Subproblems. 1. What is the knowledge of CSW regarding the following aspects of HIV? A. Cause. B. Transmission. C. Prevention. D. Treatment. 2. What is the attitude of CSW towards the following? A. People living with AIDS. B. Towards use of condom practice. 3. What proportion of CSW practice condom use? Example 2, is herbal medicine widely used among community residents? Main problem. What is the prevalence of use of herbal medicine among residents in Region 2? Subproblems. 1. What is the age distribution of residents who use herbal medicine? Or what is the distribution of residents who use herbal medicine in terms of 1.1 age, 1.2 educational attainment, 1.3 economic status, 2. What type of ailments are herbal medicines commonly used? 3. What herbal preparation is commonly used? Is herbal medicine widely used for common ailments among community residents? Main problem. What is the prevalence of use of herbal medicine for common ailments among residents in Region 2? Subproblems. 1. What is the age distribution of residents who use herbal medicine? 2. What type of illnesses are herbal medicines commonly used? 3. What herbal preparation is commonly used by residents of? Research question. Association studies, intervention studies. Pico/T format. Elements of the statement, Haynes, 2006. P. Patient/population, target P. I. Intervention being evaluated. C. Control. O. Outcome, effect of interest. T. If applicable. Time frame, period of observation. Example of research question, intervention study. Effect of clinical intervention. Among critically ill COVID-19 patients with acute respiratory distress syndrome, is ECMO alone or combined with mechanical ventilation compared to mechanical ventilation alone effective in improving survival? htac.gov.ph. P. Critically ill COVID patients with ARDS. I-1, ECMO, 2, ECMO plus mechanical ventilator. C. Mechanical ventilator. O. Survival. Effect of public health intervention. Does monitoring blood pressure in urban African Americans with hypertension, P, improve blood pressure control, 0, within the 6 months of initiation of the medication, T. https://libraryguides.nau.edu/c.php ? G equals 66. 5927 and P equals 4682772. P. Africa Americans with hypertension. I. Telemonitoring of BP, plus. C. Telemonitoring of BP. 0. Improved BP. T. 6 months. More examples, Pamela Buzzard Research Guides, Evidence-Based Practice, 1. Ask, Pico, T, Q. Hypothesis, Epidemiologic Hypothesis, Quantitative Research. Statement assuming that 2 factors are associated. Elements. 1. Causal factor, exposure to factor, beneficial or risk/harmful. 2. Effect of interest, outcome, disease, other conditions. Exposure dash. Rightward arrow outcome. There is an association between X and outcome Y. Elements, McMahon, 1996, testable format. 1. Causal factor being considered, beneficia. Or risk/harmful. 2. Effect of interest, disease, condition. 3. Population to whom the hypothesis applies. 4. Dose response, i.e. the amount of the causal factor lead to the stated effect. 5. Time response, i.e. the time elapsed, cause-effect. Hypothesis, examples. A. Strategy in communities with PTB prevalence of less than 20% is effective in decreasing the prevalence of PTB by 50%. B. Intake of 300 mg per day of ABC drug taken for 1 month will result in a reduction in the degree of depression among adults. C. Compared to non-drinkers, drinking 1 shot of alcohol per day for 2 years reduces risk of fatal and non-fatal heart attacks by 25 to 40% among male adults, McMahon, 1996. Note, research demands a clear statement of the research problem/Q. Specifies the following elements. 1. Study variable, characteristic. 2. Study unit. 3. Time element, if applicable. Types of research questions in quantitative research. A quantity to estimate. A characteristic to describe or compare. An association to establish. Sanchez, F., Morelos, S., Baltazar 1989. Quantity. Characteristic to describe. Association to establish. What proportion of COVID-19 laboratory-confirmed cases have clinical signs and symptoms? What is the geographic distribution of COVID-19? Is there an association between age and COVID-19 mortality? What is the mean age of COVID-19 confirmed cases? What is the mode of transmission for COVID-19? Is the risk of death higher among intubated COVID-19 patients? What proportion of intubated COVID-19 patients died? What is the demographic and clinical profile of COVID-19 confirmed cases? How does X, intervention, compare with Y, standard of care or control, in the management of pain among patients with chronic back pain after 2 weeks? What proportion of Filipinos know about the mode of transmission of COVID-19? What is the time trend in utilization of AP services before, during, and after COVID-19 pandemic? Research problem is. A statement about. Concern/issue. Gap in knowledge. Requires research for its solution based on knowledge generated. Stated in clear, specific, and measurable terms. Elements, variable, study unit, time, if applicable. Clarify and measurability of research problem/Q. If the statement can be classified into one of 3 types of research. Research problem is not. 1. Not a research topic. Research problem is not equals to something to solve/address through a scientific data collection process. Research topic. Something to read up about/to get information on. 2. Not about absence of something. A. There is no Bimonk facility in province X. Is a health problem. Not a research problem. B. There is lack of evidence that, not a research problem. 3. Describing the research problem and its context. Statement of the research problem. Describing the research problem. Concise explanation of what is to be researched about and its context. Purpose is to introduce the reader to the problem/issue to be addressed. Place the problem/issue in the context of what is known and what is unknown. Specify the research questions and research hypothesis. Provide the framework for reporting the result. Source, reference librarians' research guides, organizing academic research papers, the description is either incorporated in the introduction section. Standalone section statement of the research problem. Problem statement format. Part 1. Describe the ideal/desired situation about the area of concern, or what is known about the area of concern. Transform the stated problem area, situation that was identified in the problem ID process, to a positive or desired situation. Health problem. Poor quality of health data. AP vaccination coverage has been below target. Poor adherence to HPN medication. Desired situation. Complete and accurate health data. Improved vaccination coverage. Improved adherence to HPN medication. Part 2. Explain the current situation and how it falls short of the ideal/desired situation, or what should be known. Briefly explain how the situation deviates from the ideal state. Support all claims, cite published reports. Part 3. Explain how the research will contribute to moving the current situation to the ideal/desired situation. Convincing enough. Part 4. State the research question and hypothesis, if applicable clear and specific. Option A, desired current situation framework. Option B, known-unknown framework. Part 1. Describe the ideal/desired situation about the area of concern. Part 1. What is known. Part 2. Explain the current situation and how it falls short of the ideal/desired situation, or what should be known. Part 2. What should be known. Part 3. Explain how the research will contribute to moving the current situation to the ideal/desired situation. Convincing enough. Part 3. Explain how the research will contribute to moving the current situation to the ideal/desired situation / fill in knowledge gap. Convincing enough. Part 4. State the research question and hypothesis, if applicable. Clear and specific. Part 4. State the research question and hypothesis if applicable. Clear and specific. Examples. 1. Factors influencing choice of skilled birth attendants at antenatal care. Nyongisa, CETL 2018. Desired situation or what is known. Several studies have examined factors that promote or hinder use of maternal health services. These studies assessed factors within specific age groups, in specific regions, quality of health care and mainly within public health institutions. Current situation or what is unknown. Little is known of the demand for skilled birth attendants and which factors influence the choice of place of delivery. The choice of place of delivery affects if one receives skilled attendants at delivery, which in turn impacts maternal mortality. How the research results will contribute to moving the current situation to the desired. Since service utilization is greatly determined by the perceived quality of care, it is crucial to comprehend the women's perception of antenatal care, ANC, as an entry point into the continuum of maternal care and their level of satisfaction with the services provided. Statement of the research question or objective, and hypothesis, if applicable. This study examined factors that influence the choice of skilled attendants at ANC. 2. Prevalence of health literacy in the Philippines, first nationwide survey. Tolabing, MC et al. Numerous countries worldwide, including those in Asia, have undertaken comprehensive nationwide surveys on health literacy, forming the basis for tailored interventions aimed at enhancing population health literacy. In contrast, the Philippines currently lacks essential information regarding population health literacy, with no existing government policies or programs addressing this issue. Despite the National Health Literacy Bill being introduced nearly a decade ago, its passage through the Philippine Senate is still pending. To bridge this gap in knowledge, this study seeks to address the following research questions. What is the prevalence of limited health literacy among Filipinos aged 15 to 70 years, and in which dimensions and domains of health literacy do Filipinos exhibit deficiencies? Tolabing, 2020. Introduction. Dental practice differs from many other health professions, with practitioners undertaking multiple high-risk surgical procedures on a daily basis and working predominantly in private practice, fee-for-service, rather than spread across the public and private sectors. 1. These characteristics may place dental practitioners at an increased risk of certain forms of legal and regulatory action compared with practitioners from other health professions. Although there is a growing literature on malpractice claims, complaints, and disciplinary action involving medical practitioners, little is known about the risk factors for complaints about practitioners in the dental professions. Thomas Laet. Al., 2018. Characteristics of a research problem/Q statement. 1. Addresses a gap in knowledge. To contribute to the existing body of knowledge. To contribute to addressing the identified health problem. 2. Lends to investigation through systematic data collection. Study variable. Study unit. Time, if applicable. 4. Formulating the research objective. Problem identification summary. 1. Stating the research problem. Identifying a problem area on a topic of interest. Stating the research problem. 2. Clarifying the research problem. Analyzing the problem, feasibility, significance, ethics, related components, stating the problem clearly, specifying the variable and study unit, question form. 3. Describing the research problem. Describe the ideal/desired situation about the area of concern, or what is known about the area of concern. Explain the current situation and how it falls short of the ideal/desired situation, or what should be known. Explain how the research will contribute to moving the current situation to the ideal/desired situation. State the research question clearly, variable and study unit, and hypothesis, if applicable.